Hi, my name is Leisha. I'm a learner at Nightingale College. This video demonstration is for my BSN 206 Section 15. Today, I'll be demonstrating how I apply dressing change using sterile technique. I'm wearing my pewter color top and bottom logo with Nightingale College badge. I have my hair tied. I'm not wearing any nail polish, ring, or acrylic gels. I have my sleeves pulled up for the demonstration here. When I go into patient room, first I want to knock on the door. Hi, Mrs. Smith. My name is Leisha. I'm going to be your nurse today. How are you doing? Then after I introduce myself, then I'll identify the patient by using armband. Can you verify your first and last name and your date of birth for me? And then after that, I'm going to explain my procedure. Mrs. Smith, I like to do your dressing change. Is that okay with you? And if the patient give me permission, I'm going to close the curtain. I'm going for privacy, and I have my supply ready to go here. I'm going to tilt the camera down so you can see my wound here and my supply. Okay. I have my dressing kit, clean pair of gloves, and biohazard bag. Okay, first I'm going to clean my do hand washing. I'm going to use the hand sanitizer for the purpose of video, and then apply clean gloves. Next, I like to apply the dressing kit. When I want to maintain sterility when I have the dressing kit. I make sure that it's open all the way and that nothing passes through it. Now I'm going to remove the old dressing by removing the edges first, gently. And I'm going to pull it off here. And then discard into the biohazard bag. I'm going to get rid of the old gloves here. I can hand sanitize again. I'm going to open the sterile gloves here. Oh, I do like to talk about my working hand and non-working hand. My right hand is my working hand, and my left hand is non-working hand. So I want to make sure I'm passing the supply with my non-working hand to my working hand when I'm doing this technique. Next, I'll show you how I apply sterile gloving. Okay, I have my sterile with 2 fingers. Go to the other hand. Okay, now that I have it on, I'm going to use the clean area to remove the wrapper here. Next, I'm going to use the antiseptic applicator to clean the wound. You can pinch here and then clean the wound from inner area and then to outer area, which is the cleanest to the dirtiest part. And then I'm going to dispose that. Next, I will be blot drying the wound using gauze. From the same thing, inner area to the outer area. Okay, next I'll be applying the Tegaderm. Before I apply the Tegaderm, I want to make sure I palpate the area to see if there's any discoloration or any type of drainage or discharge, and try to note it in color. If I need to measure it, I can also measure it too. And now I'll apply the Tegaderm. After I'm done, I am going to initial and date. Okay, now that I am all done, I'm going to check with the patient to see how the patient is doing. Mrs. Smith, how are you doing? Do you feel comfortable? Great. I'm going to document the procedure. I'm going to remove the gloves, do proper hand hygiene, and then discard all the items. Thank you, Mrs. Smith. I'm going to do documentation. And this will conclude my presentation for dressing change using sterile technique. Thank you for watching.